Okay, I'm Minjie. I come from Hebei. My topic is safety and immunogenicity of CoronaVac in children aged 3 to 17 years in phase 1 and 2 clinical trial. I will report from the following aspects: practical introduction, study team, sponsor, SINOVAC-LI thesis, study institution, Hebei provides Center for Disease Control and Prevention. Set of the clinical trial, Center for Disease Control and Prevention of Zhanghua County. Objective: to evaluate the safety and immunogenicity of inactivated COVID-19 vaccine in population aged 3 to 17 years. Phase 1 clinical trial to evaluate the safety, tolerance, and preliminary immunogenicity of different dosage vaccine in healthy population aged 3 to 17 years. Phase 2 clinical trial to evaluate the immunogenicity of the safety of different dosage vaccine in healthy population aged 3 to 17 years, and to determine the appropriate dosage for further clinical evaluation. The study design is a single center, randomized, double-blind, placebo-controlled phase 1 and 2 clinical trial. Study population: children and adolescents aged 3 to 17 years. Sample size: total of 572 subjects, with 72 in the phase 1 and 480 in the phase 2. Dosage: low dosage is 300 SU, and medium dosage is 600 SU. Design is a phase 1 clinical trial. 72 subjects were enrolled in the phase 1 clinical trial, divided into 3 age groups. Each age group was divided into low dosage and the medium dosage. The groups were sequentially enrolled according to the principle of age de-escalation and dose escalation. In each dose group, 9 subjects were randomly assigned to receive the vaccine, and 3 subjects to receive the placebo. After 7 days of follow-up for safety were required before entering the next stage. Subjects received 2 doses of vaccine on day 0, 28. Blood and urine samples were taken before and on day 3 after each dose, and tested to investigate any abnormal changes of hematology, biochemistry, and urine routine indexes. Blood samples were collected on day 0, 28, 56, 208, 388 from subjects to evaluate the neutralizing antibody titers. Subjects were observed in the study site for at least 3 minutes after vaccination. The listed adverse events were recorded for 7 days after each dose, and isolated adverse events for 28 days. The serial adverse events are recorded throughout the study, and the follow-up will continue until 12 months after the last dose vaccine. The phase 2 clinical trial used the same safety observation method. In the phase 2 clinical trial, a total of 480 subjects were recruited including 180 aged 12 to 70 years, 180 aged 6 to 11 years, and 120 aged 3 to 5 years. Subjects were randomly assigned to either low-dosage vaccine, medium-dosage vaccine, or placebo. Subjects were enrolled and received 2 doses of vaccine on day 0-28, and collected blood samples on day 0-56. 240 subjects were collected blood sample on 3 months after the second dose, and another 240 subjects were collected blood sample on 6 months after the second dose. The new protocol planned to add booster immunization. Only subjects in vaccine groups received booster dose at 10 months or 12 months after the second dose. Implementing status. This is the clinical trial timeline. The phase 1 clinical trial was launched in October 31st, 2020. The phase 2 clinical trial was launched in December 12, 2020, and completed the second dose of vaccination in January 2021. There are some pictures of on-site investigator training, on-site assessment, process simulation, take-off meeting and training, informed consent, blood collection, vaccination. In the phase 1 clinical trial, 110 individual sent the informed consent. 38 were included. 72 were enrolled and completed blood collection before the first dose. 71 received the first dose. Before the second dose, at 28 days after the second dose and at 6 months after the second dose, 69 subjects completed blood collection. In the phase 2 clinical trial, 515 individuals were screened. 35 were included. 480 were enrolled and completed blood collection before the first dose. 479 received the first dose. 467 subjects received the second dose. 462 subjects completed blood collection at 28 days after the second dose. 227 subjects completed blood collection at 3 months after the second dose. And 233 subjects completed the blood collection at 6 months after the second dose. Safety evaluation. In the phase 1 and 2 clinical trial, a total of 550 subjects received at least 1 dose of vaccine or placebo. The overall incidence of adverse events were 39%. The overall incidence of adverse events related to vaccination were 26%. The overall incidence of the adverse event unrelated to vaccination was 20%. Adverse reaction. The overall incidence of adverse reaction was 26%. The overall incidence of local adverse reaction and systemic reaction were 14% and 15%. The overall incidence of solicited adverse reaction was 24%. The overall incidence of unsolicited adverse reaction was 6%. The most common adverse reaction were injection site pain and fever. Except for a higher prevalence of injection site pain into vaccine groups than that in placebo group, there were no significant statistic difference in the prevalence of other solicited or unsolicited adverse reaction among three groups. Adverse reaction severity. Most adverse reactions were grade 1 and grade 2 in severity. The incidence of grade 1, grade 2, and grade 3 adverse reactions were 20%, 11%, and 0.36% respectively. Only 2 subjects reported grade 3 adverse reaction, both fever and recovery. Immunogenicity evaluation. In the phase 1 clinical trial, 20 days after the second dose, the seroconversion rate in low dosage group, medium dosage group, and placebo group were 100%, 100% and 0% respectively. The GMT were 55, 117, and 2 respectively, compared with 20 days after the second dose. The seroconversion rate of GMT decreased significantly in low dosage group 6 months after the second dose. In the medium dosage group, the seroconversion rates were still 100%, while the GMT decreased significantly. In phase 2 clinical trial, 28 days after the second dose, the seroconversion rate of neutralizing antibody in low dosage group, medium dosage group, and placebo group were 96%, 100%, and 0% respectively. The GMT were 86, 142, and 2 respectively. Compared with 28 days after the second dose, the seroconversion rate and the GMT did not decrease significantly 3 months after the second dose. The seroconversion rate and the GMT decreased significantly 6 months after the second dose. In the medium dosage group, the seroconversion rate decreased slightly, while the GMT decreased significantly. In different age subgroups, the seroconversion rate 28 days after the second dose reached more than 92% after receiving the vaccine in all age groups. The seroconversion rate 3 months after the second dose exceeded 97% after receiving the vaccine in all age groups. 6 months after the second dose, the seroconversion rate in the low dosage vaccine and the medium dosage vaccine were 100% in 3 to 5 years old age groups, 94% and 100% in 6 to 11 years old age groups, 69% and 88% in 12 to 17 years old groups, and which were significantly decreased. The seroconversion rate of medium dosage group were higher than low dose group in age subgroups. In different age subgroups, the GMT 3 months after the second dose of vaccination, the GMT of subjects in all age groups had no significant downward trend, especially the GMT of children aged 3 to 5 years after the second dose was comparable to that of 28 days after the second dose. 6 months after the second dose of vaccination, the GMT showed significant downward trends in all age subgroups over time. Conclusion: favorable safety of CoronaVac in population aged 3 to 70 years were confirmed. The incidence of adverse reaction showed no statistically significant difference among 3 groups. It was shown good immunogenicity in healthy population aged 3 to 70 years. The seroconversion rate and the GMT of medium dosage group were higher than that of low dosage group. There were no significant decrease of the seroconversion rate and the GMT 3 months after the second dose, while the GMT showed significant decrease 6 months after the second dose. It is showed that the population aged 3 to 17 years should receive the booster dose of vaccination. Thank you.